Hello, wherever you are, and welcome to this webinar. My name is Tom Goddard. I'm the founder and chief executive officer of Integral Healthcare Solutions. And today, my colleagues and I will be presenting a webinar on the do's and don'ts of accreditation, tips that will help across all accreditation platforms, and frankly, across many accreditation programs, although we'll be specifically speaking more toward URAC than other accreditation programs, but these are generally good ideas across that whole world. We'll introduce ourselves, and then I'll talk a bit about the company, and then we'll get straight into the webinar. Let me toss it to you, Lesley. Tell us who you are.
I'm Lesley Malus. I'm president of Integral Healthcare Solutions. I started in the Canadian healthcare system, worked for one of the Mid-Atlantic health plans, and then I joined URAC as a reviewer in 1997. In 2003, I thought it'd just be more fun getting applicants ready. So that's what I've been doing with Tom and later Sue since then. Sue, you're on mute.
Hi, I'm Sue DeMarino. I am a registered nurse. I'm the Chief Clinical Officer at IHS. I started my career in the accreditation area with URAC in 1999, and then I joined Tom and Lesley in 2015. And so I'm really happy to be here today to talk to you about the do's and don'ts. Tom?
Thank you, Sue. My background is in law and psychology. I went to URAC a little bit after Lesley and a little bit before Sue back in '98, late 1998. I served there as the chief operating officer and general counsel, and also as a reviewer for a couple of hundred different reviews over that period of time I was there, and then founded this company in 2002. Integral Healthcare Solutions specializes in helping healthcare organizations achieve and retain accreditation. And in addition to that, because of the obvious connection, we also help some organizations with their general compliance issues. But we are a specialized firm for accreditation, and we serve applicants for accreditation across most of the healthcare platforms. URAC, Joint Commission Specialty Pharmacy, ACHC, NCQA, and VIPS. At least those that are the ones that pop to mind. So so in this webinar, you'll be able to ask questions. You'll see a spot at the bottom that called Q&A. You can submit your questions to us, and we'll do our best to respond to those. At the end, we'll also give you some polling questions that we'd be so grateful if you would respond. It helps us to best customize our webinars and our services to our clients and prospective clients. So it'd be very helpful if you could respond at the end. And then after we're all done, you will at some point get an email from our team telling you how you can get a copy of the slides and the video and so on. So watch your email for that. Let me share my screen now, and we'll just jump right into this. So I'll take this first section in contracting. and this piece of contracting is before you even start your process, you've got to contract with perhaps consulting firms, us or one of the other consulting firms out there. And the reason we put that before you're completing your contract with URAC is if you're a first-time applicant and you don't know how prepared you are, for some organizations, it's been quite useful to start that gap analysis process, which we'll talk about later, before you actually complete your agreement with URAC or the other accreditation firms. Because at least with URAC, there's a time, the clock starts ticking. And you have only a few months after you sign your accreditation agreement to submit your documentation, and you may find in your gap analysis that you have more than, let's say, 6 months of work to do, but URAC will give you 6 months. So, and they've been shortening that lately, so you have less time than accrediting applicants from previous years had. in order to get your documents in. So, so think, particularly for first-time applicants, think carefully about when you're going to contract and when you're going to with IHS or another consultant, and when you're going to contract with URAC. If you're a reaccreditation organization, as you know, URAC is in charge of your time schedule, so you'll sign the accreditation agreement when it's time to sign the accreditation agreement in order to prevent your accreditation from lapsing. One of the things that you'll need to be able to draw the distinction between in your dealings with URAC is the difference between your relationship with a sales manager and your relationship with your account manager. The sales manager is the person at URAC that helps you sort out things about having multiple sites, because there are different fees attached to that. So you want to get as much of your business model into the hands of the sales manager as you can, so that anything like multiple sites or remote sites can be sorted out early. It's a lot easier to do it at the beginning than in the middle. Now, the account manager has a different set of functions. They serve as the go-between between you and URAC at the substantive level, and particularly that's the person that you should go to request any extensions. If you should have a strange thing happens that doesn't allow you to submit on time, there's a whole process to go through for requesting and receiving extensions, and that's handled at the account manager level. So the sales manager won't be able to help you with that. So I will toss it to you, Sue, for the next piece.
Okay, the other thing that's really important for you to understand is the two pieces of information you have to provide to URAC. Part one, I like to call the demographic information, is submitted at one time. You could submit part one and part two together. URAC no longer does it that way. And the reason why I'm bringing it up is sometimes when you submit the demographic information, it also includes things like your organization's legal documentation, licensing information. It requires you to identify who your senior leadership is, whether you do any delegation, things like that. Well, at times, URAC may find that the information is not clear enough, and they may request additional information. That's what an RFI is. It's request for information. And sometimes it can take 2 to 3 weeks before they finally approve the part one of your application. Why am I telling you this? It's because you cannot upload the part two, which is the documentation submission, to URAC until part one has been reviewed and accepted. So for instance, if you don't start this process early on, like let's say your desktop review is due next Monday and you didn't start it till this Monday, you may miss your time frame if they request additional information. So I would encourage you to complete the part one as soon as possible, so that it's over, it's done with, and you know that URAC has accepted it. And then part two, we often refer to that as your index date. And in your contract with URAC, they're going to tell you, as Tom mentioned a little while ago, the actual date that you have to submit your documentation. And what they're expecting to see are your policies, procedures, workflow, supporting documents. But one of the things that you need to be aware of is that there's a limit of 10 unique documents per standard. So if one policy addresses 12 elements in a standard, that's only counted one. That's what I mean by unique document. If you're using it for multiple elements, that's fine. It only counts as one. But if you have more than 10 unique documents, you will be unable to complete the upload into URAC's accredited system. The other thing you need to know is there's a size limit on your documentation. The size limit is roughly 4 megabytes. So you want to make sure that you're looking at that if you're getting an error message. And I'm going to toss it back to Lesley to speak about the gap analysis process.
Thank you. And just one comment about what you said, Sue, is sometimes what I find with our applicants is when they have more than 10 documents, they can scan 1 or 2 documents into one PDF and count that as one document. So you can submit, for example, 3 different minutes that would, 3 different meeting minutes that would go into one scanned document. That would be one document. And that's when you need to start watching for that size limit. So I'm going to talk about the gap analysis. And the first thing that you should be doing in your gap analysis is really just identifying a lead who's going to shepherd you through this, make assignments, break down the standards, and see who should be the subject matter experts for those areas. And Tom's going to talk more in depth about human resources in this process. But once you have those people assigned, now it's time to dig into your accreditation guide and review your standards. You have the standards and you have the accreditation guide. I like to look at the standards as the law. Here's the statement of law. And then the accreditation guide has the interpretation of the law, meaning it has interpretive information, commentary, it defines the scope, it gives you points to remember. As you do a gap analysis, standard by standard, you're going to want to dig in, take a look and make sure you have an understanding of it, review those accreditation interpretation information in your accreditation guide, and then start doing a gap of finding out, what do we need to submit here? There's evidence for desktop review that URAC defines for you. And in that evidence, it almost always asks for some type of formalized document, such as a policy and procedure or an org chart. And then from that point, you start looking at, well, is there also supporting documents that we need? Once you've identified what you need to submit, that's the time to figure out, we do have a policy and procedure, for example. Our applicants do have policy procedures. Now, what as an applicant do we need to work on to make sure it's going to be URAC compliant? When we at IHS work with our clients, we do a deep dive into the intent of the standard. We explain what needs to be submitted, and then we speak with our applicants about what it is they need to work on to develop those materials. So I will encourage you to take a look at your accreditation guide to help you identify what your gaps are. Tom? You're on mute.
I'll just add one more thing to what you were talking about, Les, and that is those of our clients that work with us also have interpretive information available to them in the form of tips and tricks. They are not just a regurgitation of the URAC interpretive information, but they are also an updated version of it because we are constantly watching reviewer interpretations of standards. If they start to interpret a standard slightly differently, or start requiring a document, let's say at the desktop review stage, as opposed to the validation review stage, we make a note of that in our interpretive information called tips and tricks. So those of you who are our clients, make sure you check that as well as you're figuring out what documents to submit. I want to talk very briefly about accreditation management. This is a complex project. Going through accreditation isn't like walking down the hall going from room A to room B. It involves a lot of moving parts, even for the simplest of healthcare organizations. I'll use us as an example. We are certified under URAC's organizational management standards. And that is, even that, which is it's a subset of those standards that you all would be going through. Even that involved the kind of all hands on deck. And so managing the process is a thing. When we started doing this work 2 decades ago, we used spreadsheets, and that's still, spreadsheets are wonderfully flexible and useful. And if that's what you've got, that's what you've got. We ultimately evolved out of that and created what you've already heard us talk about. That's a software application, online application called Goldfinch, in which we house all of the standards, all of the interpretive information, both from URAC and from us, as well as template policies and procedures, external links to hyperlinks to useful resources, and so on. You might want to use your organization's document and project management software as well. Just make sure you've got a good system in place and don't presume that this is going to be handled on pieces of paper very easily, at least. And then the team. How should we think about the team that you're going to have doing this? First of all, you're going to want to one or more dedicated leaders who are clearly identified as being responsible for driving the process forward. And those folks or that person need to have the full endorsement of the most senior leadership in the organization. Having that kind of buy-in from leadership to the activities of your dedicated leaders is going to be critical. For example, when let's say a document is needed out of the IT department, we need a report, and the IT department says, yeah, but we're doing this data run over here. We can't do the report, not until 3 weeks from now. Without the buy-in from senior leadership, those kind of requests are likely to fall on dead ears, particularly in busy times. And so an acknowledgement by senior management that not only is this process important, but that suggests that the leaders have some say in how to distract people from their regular jobs. This needs to be a part of the regular job. And this leads into the notion of a team approach. The team is the whole company, at least that part of the company that's within the scope of the accreditation. You won't do very well if you've got an accreditation team over here who is seen as being solely responsible for the accreditation process, because accreditation is of your whole organization. You're going to need to make sure that the policies are written properly. You don't want this team over here doing that. You want people in the departments doing it, and you want to make sure that those policies are implemented properly. Again, that's not the responsibility of the accreditation department or identified dedicated leaders. No, everybody's got to be on board with that. And then finally, make sure that you've got somebody identified as doing a quality check for each of the document that is going into the process for URAC's review, to make sure that you're uploading the documents that you want. So I will turn this over to Sue.
Okay, and I'm going to continue talking about the desktop review, that part 2 that I was speaking about earlier. So now you're developing your policies and procedures, you're adding citations and things like that. A common mistake that people make is that they will reference a policy, a document, a workflow in the cited area that they've told URAC demonstrates that they're in compliance with this standard element. Well, if you're referencing a policy in the cited area, you must also submit that reference policy. So please remember that. And then the other thing that you need to know about your policies and procedures is that if you are seeking accreditation or reaccreditation prior to the Core 4.0 coming out, URAC has this requirement that you must review your policies and procedures on an annual basis. And I wanted to remind you that URAC defines annual as month year to month year. So for instance, if you approved a policy on June 1st of 2019, by June 30th of 2020, that has to be reviewed and approved again. If you do it July 1st, you're out of compliance with URAC's definition of annually. Now, if you are seeking accreditation under the new 4.0 version of core or specialty or mail or case management also, you now have a requirement to review your policies and procedures at a minimum of at least every 36 months. So you're going to define in your policy what that time frame is. I want you to be very cautious in making sure that you're complying with what your policy says, okay? Because URAC will hold you to whatever your policy says. The other thing that's sometimes missed is that organizations will take the standard, they'll copy it into a Word document, and then they'll add narrative that describes how they believe they're meeting the intent. That is not a formal document. URAC will not accept it. They also do not accept draft documents. They have to be finalized, formal policies, procedures, workflows. And also you want to make sure that your policy on policies and procedures and how you're formatting it is compliant. I will tell you that some of the accreditation bodies have very, very specific requirements of what needs to be on a policy. So for instance, if you were seeking VIPS accreditation, you have to give your address on your policy and procedure. You have to identify the name of the person that is the approval authority. URAC, on the other hand, only requires you to identify who the approval authority is, meaning the title of that person. And you want to remember that staff, regardless of which version of standards that you're seeking accreditation under, your staff must have access to a master list for ease of finding whatever they need to look at. Next standard, please. Next slide.
And before we go to the next slide, I see that we have a question that's easily answerable. Do you know when URAC will move to Core 4.0 on accreditations other than case management? Well, they already have. Our certification of organizational management is essentially a subset of version 4.0. And last October, URAC rolled out 4.0 to mail service and specialty pharmacy, although they did an interesting thing. They actually got rid of core as a separate module. So they took all those core standards and just wove them into version 4.0 of mail service pharmacy and specialty pharmacy. We know that they are working on a whole batch of new standards this summer. I'm not quite sure how the pandemic has impacted the timing of that, but we are expecting something to come out for public commentary later this year among programs. I believe it's safe to say utilization management programs, health plan, PBM, health network are kind of the next round that are going to come out. I wouldn't think that they'll be implemented until 2021, but we'll keep your eyes peeled for public comment period as URAC starts to go through that process with these other standards. Back to you, Sue.
Okay, great. So the other thing I wanted to speak about is not only policies and procedures, but supporting documentation. URAC oftentimes will require you to submit meeting minutes, dashboards, so from a quality perspective for your performance indicators. So making sure that you have a mechanism to be able to demonstrate that you're tracking and trending that information. Dashboards are very helpful. Depending on which version of the standards you're under, you may or may not have quality improvement projects. And so you'll want to include those if it's a requirement. Reports, analysis, things like that they're expecting to see. Marketing material, review and approval. A code of conduct under the new version of the standards. You have a business code of conduct. You have a healthcare ethics component. There's business continuity testing requirements. There's risk assessment requirements. And then any attestations where you're not, where a standard is not applicable to your organization. An example of that might be in the pharma world. If you do no compounding, you might submit an attestation letting URAC know that you do no compounding. And again, attestations need to be on company letterhead, need to be signed and dated. And then when URAC's coming out to do their validation review with you, you want to make sure that you update those attestations to let them know that this is still a true fact, that you are still not doing compounding. Tom, next slide. Okay. All right, version control. This is an area where I've seen organizations really struggle. It doesn't happen often, but when it happens, it's almost catastrophic because they have multiple versions of the same policy and procedure. And so you want to make sure that there's no conflict between your policies and procedures and that you do not have multiple versions of the same document. If you contract with IHS, our system has, our Goldfinch system has a replacement function. So when you update the policy, you can replace it in your document library, and then it updates it in every standard and element where that policy is attached. So that's a really nice feature. That is not a feature in URAC's AccrediNet. So it's really important that you want to make sure that you have the right version of your policies and procedures. Now, When submitting to Goldfinch, if you're a client of ours, or to Accreditation, which is URAC's system, you want to make sure that you provide good citations so the reviewer knows exactly where to find the information that demonstrates compliance. A good citation from my perspective is a page number, a section number, a subsection number that drives it right to it. If you're a client of IHS's and you're using our templates, we provide comment boxes that identify which standard applies to what section. You can then use those comment boxes to define your citations. Bookmarking is another option that you can do. Some organizations like you to highlight and bookmark. So depending on which accreditation body, there may be a little nuance changes that they may wish to see. And then finally, communicating with your consultants, if you're using consultants. So for instance, if you have a question about a specific standard, you can either email them, but again, if you're our client, you can ask the question right within our Goldfinch system. It's tied to the specific standard, and then you can go back and reference it later to say, oh, what did Sue say about, cold chain, for instance? Well, you can go back to the cold chain standard. The task, the original question that you asked is there, as well as my response. And now I think I'm going to give it back to Tom.
So at this point in the process, you've now submitted. The way it works with us is we go through our whole consulting process, one standard at a time. And once we have signed off and you have signed off on all the standards, you hit the submit button, and then things start to happen. Once you hit that submit button, that uploads you. What we do is we upload your documents from Goldfinch to Accreditation, and once we've completed that, then you hit the submit button. Post submission, several things will happen. First of all, you'll receive the names of the reviewers who are on your review team. That can be up to as many as 3, or if they're training someone, even 4, as is one of our clients is seeing reviewers, or as few as 1 or 2, depending on the program. So you only at that point will you actually find out who your reviewers are. And they may not be the same people who did your desktop review process. At that point also, your reviewers will want to schedule a call with you. This is an important call. Do not skip it. It's an opportunity for you to just talk with the reviewers about your business model and your structure, and to raise any particular issues that they might be interested in hearing, such as acquisitions, recent management changes, whether you have multiple facilities. Sometimes one of our pharmacy clients will, between the time that they signed up with URAC and the time that they've submitted their documents, add a facility. We opened up a new pharmacy down on the southeast side of town or on the other side of the state. Well, these are definitely things that you're going to want to raise here. If you haven't already raised them, as your contract might have required that you do earlier in the process, but certainly by this point you should let the reviewers know about any of these kind of strange things, or if you've got a little micro office 100 miles from your main office that does certain functions that may or may not be part of the accreditation. This is exactly the time to talk through how that process, how these features of your organization are going to impact the accreditation process. You don't want surprises for the reviewers in the final stages. You want them as early as you can identify to be out on the table. This is also an opportunity in this call to begin the conversation with URAC about timelines. They'll say something like, oh, you're going to get your RFI, your request for information, which we'll talk about later, in about 5 weeks, and let's schedule our validation review date or dates. So that's, as you can imagine, a very key call. And so I will now bounce this to Lesley.
Thank you. So I don't want anyone to feel insulted about the request for additional information. Whether this is your 3rd time going for accreditation or your initial, URAC almost always asks for clarification. So I want you to be prepared for requests for additional information. We're going to do another gap. We're going to review what the comments are. They're going to send you an email. Your reviewer, your lead reviewer will send you an email saying we've completed your desktop review application and we need some clarification. Go into Accreditation and download the score sheet. And the score sheet will list all of the standards and whether they're met or not. If they're not met, it'll describe what the issue was and what your recommendation is. And now it's time to complete that gap. There are several reasons why they need clarification. Sometimes they really just miss the intended language, and your policy and procedure, for example, is absolutely compliant, but they missed the area you wanted them to review. So maybe that's one of the reasons. Another reason is that even though you're a reaccreditation applicant and you're coming through for your reaccreditation on the exact same standards as last time, the same version, and the standard hasn't changed one bit, sometimes the interpretation has changed in the last 3 years. So they'll want you to make some changes. And finally, you may have made a mistake. Maybe you submitted the wrong issue, wrong document, or maybe you really didn't meet the intended expectation of the URAC reviewer. So what we do at IHS is we complete a gap analysis, and we like to know and track the RFI issues as a quality metric. So did we miss this? Did we give you faulty advice? Is it a new interpretation? And these are really important things so that you can help yourself get prepared for your implementation of these standards compliantly. When you are getting ready for your RFI and you're going to resubmit these documents, you need to change the name of the document. So in that very first scenario that I gave you, where you submitted a compliant policy but they missed the intended language, you need to resubmit that exact same policy but change the title to add the letters RFI to it. So the title would now be RFI Policy and Procedure XYZ. And that's how URAC will know where in the system it is and how to review the information. And if you're one of our clients, it's the same thing. You'll resubmit it to our Goldfinch platform, and we'll be able to review the new and intended information with the citation for exactly where you want us to review it. And finally, when they are going to give you this RFI email that says we've completed the RFI process, the desktop application process, and it's time for an RFI, they'll offer you a call. They'll say, let us know if you want a call. Please do take that call. Can I have the next slide, please? It's very important to pay attention to the time frame, because when you get that email from them letting you know that the desktop application is complete, the time starts ticking now. You're only going to have 30 days to respond to the RFI. And this is in the email where they offer you that call to go over the RFI. Always take it, and it'll be scheduled usually about 5 business days after they sent you the email. And that's when you want to complete that gap and prepare yourself for the calls so that you can say to them, we're thinking about submitting this for the RFI. Would that meet your expectations? So it's a really good time to have that conversation. And also to run by that issue where they had the compliant language and missed the intended language. You can read it to them and they'll say, yes, that does meet it. Please just resubmit the document that, again, you will title RFI Policy and Procedure XYZ. So in your first RFI, you have 30 days to respond. Sometimes they'll request a second RFI because they're not going to complete the validation review until they feel they have your documentation demonstrating compliance. So in the second RFI, you have 10 days to respond, and you'll do the same thing. Have a gap analysis, request a call if they'll give it to you, and resubmit. And then finally, you can request, or they might provide you with a third RFI. Sometimes they'll just let you submit information, no problem, but sometimes they'll ask you to pay a fee for a third RFI if there is a significant amount of work left to it. All right, I'm handing it back now, I believe, to Sue.
Nope, to Tom.
It's to me. And I'll just add one more thing about the RFI, and that is, if that looks for you first timers, if that looks imposing, the 3 rounds, that's actually the exception, not the rule. Most of our clients have only 1 RFI. The clients that have more than 1 RFI are those that ignore what we advise them to do. Generally, if our clients pay attention to us, they get one RFI. So don't be scared. All right, so let's talk a little bit about the validation review. The validation review, and I'll speak specifically from the URAC context, but it's not all that different from the other organizations we work with. Validation review is the accrediting organization's opportunity to validate that what you said you do in your policies and supporting documentation is in fact what you do. And they do that with two basic mechanisms: the interview of staff and management and review of documents. Historically, back when the three of us started, it was entirely on-site. In recent years, URAC has been weaving in a virtual component so that a good number of the modules or sections of modules were handled virtually, and with some still on site. In these times of the pandemic, it's entirely virtual now. So URAC itself and we and our clients are all learning how to do things virtually that we didn't have to do in previous years. Sue just updated me on this this URAC policy. The COVID-19, URAC has said that it will not be doing validation reviews on site at least through the middle of July. July 17th, I think is what you said, Sue.
Yes.
You know, if I were a betting man, I would not be at all surprised to see that data pushed out, particularly as the curve in states where I live continues to go up. But anyway, so that's the current policy. At URAC, and each of the accreditation organizations has a special COVID-19 link on their home pages that'll bring you up to date on how they're doing their the whole application process, including the validation review process. So it's going to be really important that you review your agenda for requested documents. What does that mean? The URAC agenda starts out with a nice introductory letter and then a list of documents that the URAC reviewers want. Some of those, and it's a rather long list for many of the programs, some of those are actually documents that are logs from which the reviewer will select files to be reviewed. So for example, a privacy breach log, if you have 50 privacy breaches over a 1 year period, then they would want a log so they could select maybe a 10. Or if you're a health plan and you give them one of the documents listed will be a provider directory that can be used for both the credentialing and the contracting parts of the health plan standards and the network standards. And so you may want to work out, if there's going to be document pulling, you may want to figure out, work out ahead of time if perhaps you can do the document pull for those maybe a couple of days in advance of the actual validation review. This is one of those logistical things you definitely want to talk to your reviewers about. The rest of the documents and the bulk of the documents listed there are documents that the reviewers are going to expect to be able to be shown during the validation review. So don't ignore that. I mean, one of the things that has happened over the 20 years we've been doing this is that we have seen a number of times where, you know, the applicant just completely ignores the document section and goes straight into the review, but the review involves the review of documents. So make sure that you have access, ready access, split-second access, maybe a hyperlink access to each of the documents requested. So if a reviewer like covering the standards I cover, for example, which include IT, if I were to say to you, I'd like to see a most recent example of your business continuity plan test. Give me an executive summary of that. You need, that person being interviewed needs to be able to pull that up on the screen, in a shared screen, and show it. So pay very close attention to the requested documents. URAC also provides a sheet of tips for a successful review and agenda activities. So pay attention to that. They really express the reviewer's preferences to help you go through it smoothly. If you're working with IHS, we have our own version of that, that has even more suggestions for how to make it go smoothly. And so whether you're working with us or not, just make sure that you get all the documents ready to be shown. There will be tours for some applicants, depending on the program you're applying for. For example, pharmacy. You're going to need to work out with the reviewers how you're going to do a pharmacy tour virtually. Why would they want to tour your pharmacy? Well, they want to make sure that that you're storing your drugs properly, that you have eye wash stations, and they're also good. For example, eye wash stations is a good example. They'll also just want to ask a random staff member in your pharmacy, where is the eye wash station here? And if they don't know, that's a problem. So the tour is an important part of some of the accreditation programs. And all applicants that deal with PHI are going to be subject to a tour that gives the URAC reviewer a sense of the caution that your organization brings to the protection of the confidentiality of protected health information. And I will toss it to Lesley for the 12 tips.
Thank you. These are the tips that we share with our clients at the end of our mock validation review. And it's just to help you prepare for your actual validation review with URAC. So there's simple tips, and I'm going to start with number 1, which is obvious, but it's usually a problem. We want you to be on time, but be very flexible with your time. URAC might need to go into meetings earlier or later, and they're also flexible. If you tell them that your medical director, for example, has a meeting that he has to take, then they will fix the agenda. But for those scheduled meetings that you have, please, if it is an on-site, bring lunch onto campus. Don't let anybody leave the campus for the day. If it's virtual, same thing. Make sure that you're not going to leave and run errands. The name of the game is to get the reviewer out early. If things are going quickly, then they finish the review quicker, and that's an indication that things are going well. Bring props to your interviews so that even if you've already submitted that business continuity plan that Tom mentioned, you can bring it up as you speak about your information on it. And what I mean is that the reason I'm telling you this is that URAC is going to have their computers in front of them, and they're there to check off their boxes. And they have document review to complete. But if during the conversation you bring up the business continuity plan and the minutes that show discussion of the business continuity plan, well, that helps them check their boxes, and they won't go into the business continuity plan and dig deep into it. This is really good also for your quality management interviews. If you talk about the metrics, they're not going to spend as much time digging through your minutes to find things. And it not only speeds things along, but if there's something in your minutes that could potentially raise a flag or affect something negatively, then they're not going to spend that time digging through your minutes to find things. You've already showed it to them with your props. Number 3 is to have a positive attitude and try and imply that everything here works really well. What you don't want to do, you don't want to revert to before our IT systems were not so great, and now everything is fixed. Just mention that right now everything is working great. If you are new to your position and things were dropped by the person before you, you really just want to talk about how things are going well right now. If, of course, URAC asks you questions, you are welcome to say, that's before my time, but this is what we're doing now. Number 4 is, this is an open book test, and we don't want you to be afraid of turning to a colleague and asking for help to answer a question. This is definitely call a friend, open book test. I always use the example of when you watch Jeopardy from your couch, it's very easy to answer those answers that Alex Trebek is giving you, but if you are under the spotlight, you get nervous. Some people don't always test well. So calling a friend and having the policies with you are absolutely fine. It is not cheating. It's part of the process. Number 5 is to only answer the question that the reviewer is asking. Tom is a lawyer. He'll tell you to try and make this like a deposition. Just answer that question and nothing more. And if they ask you more, that's fine. But if they're not getting their answer from you, URAC will definitely ask the question again in a different way in order to extract what they need. The reason is we have lots of stories to tell. And this isn't a time issue. This is really We don't want to tell a story that, again, could take us down a path that could unintentionally affect another standard negatively. Next slide, thank you. Number 6 is, always ask these 2 very important questions. One is, did I get 100%? So first of all, if you ask that question, the reviewers will know that you got this tip from us, and it'll make them laugh. But more importantly, the reviewers cannot give you what your actual score is. You're presented as a blinded application to a committee that is going to make the final decision. And they will ask the reviewer some questions about your application and how you responded to things. But it's not the reviewer's decision to make your accreditation decision, your full accreditation, your conditional accreditation, corrective action, denial. Those are the 4 decisions. But if you ask your reviewer at the end of each interview, did I get 100%? They can give you a bit of a highlight of how you did. They might say, yep, you did really well, or I would give you a full on this, you got 100%. Some of them will even answer. Number 2, this is the most important question. After every interview, please also ask, is there anything outstanding that I owe you? So the reason for this is that you begin your interview. It's 45 minutes long. And at the very beginning, the reviewer will say to you, I'd like to see that log. And you will say, okay, I'm going to get it for you. And you continue the interview. And 45 minutes later, you're shaking hands or nodding on the virtual, and things went really well. And it's over. And the reviewer leaves. But once the interview is over, the URAC reviewer will be at their desk scoring you without that outstanding item that they needed. Which leads us to number 7. We recommend that you have a shadow for each interview, someone who's taking notes that's not answering questions, so that they can write down anything that the reviewer might be asking for. Maybe you need to get some information. While that person said, I'll get you that log, that person could probably email someone right away to get that log. So it's really important to have that shadow. Number 8, seniors who are going to be interviewed. So you're going to have seniors that are interviewed, and you're going to have frontline staff. Seniors that are interviewed, we want to make sure that they not only review the standards 2 weeks before the URAC reviewers come, but also what you submitted for those standards, so that they remember the context and the content of how you answered the standards. That way the questions will be familiar, and you'll remember by reviewing these policies how you answered them. Marketing, they always do such a great job, and they're such extroverts and great at what they do, and they're able to answer the questions, but sometimes they're answering outside the scope of what the policy and procedure says. So that's why we want everybody to review the standards and what you've submitted for them. Number 9 has to do with not only your seniors, but your frontline staff. All staff who are interviewed might be asked the following questions around these topics. And so we want you to be able to review training 2 weeks before they come to do the validation review on these topics. HIPAA and high tech. So everybody gets HIPAA training. Everybody remembers that. But sometimes when we sit with frontline staff during the mock desktop review and we say, are you familiar with high tech? They get that deer in the headlights type of look. Even though you may have completed such training a month or 2 before, it's for some reason staff frees up about that one. So 2 weeks before URAC comes, that's one of the things we recommend you review, so that all staff can answer, yes, I'm familiar with it. And it doesn't have to be a long answer about the Omnibus Act. It can just simply be, it's part of HIPAA, it's the electronic version of HIPAA, basically. It has to do with PHI. Examples of conflict of interest. So when URAC sits with frontline staff, they're going to say, can you give me an example of a personal conflict of interest? And most people will answer, I want to make sure that I don't have, or a family member doesn't have, a personal interest in the organization. If we do, we would certainly disclose that. The other example that URAC is looking for when it comes to personal interest is for people to say, if I have a file that's someone that I know, so for example in if the patient is someone I know personally, I need to abstain from that file. If it's in credentialing and it's a provider who's my neighbor, I should be, as a credentialing specialist abstaining from completing that file. The other question is, do you get a bonus? You should get everybody comfortable with answering that. They're going to ask everybody about that question, and it can get uncomfortable with some people do and some people don't. It's fine if your organization gives a bonus. What you're actually looking for is the answer. We may or may not receive bonuses, but the bonuses are not based on incentives that are based on a consumer's utilization of care that could compromise their health. The other topic is, how would you respond or handle the distressed caller? And that has to go to everybody in the organization, not just your customer service reps, not just your folks, if you're doing accreditation. It's for everybody. The history behind it is that during one of the validation reviews, a call kept going to a boardroom. And so it became clear to URAC that anybody could pick up a distressed caller. The distressed caller is defined as somebody who is either in clinical distress, meaning they could be having a heart attack or an allergic reaction, might harm someone, or may harm themselves. And you want to make sure that staff will answer a consistent story of saying, we never put that individual on hold. We flag somebody else in our organization to dial 911 for us, and we remain on the call until 911 arrives. That's what URAC's expectation is. No one's put on hold and no one's transferred. And finally, the other answer that is very often missed during our validation reviews is we ask frontline staff if they're aware of the quality department's initiatives. Can they talk about QIPs? Do they know about any of the projects going on? So make sure that you have a mechanism, whether it's sharing minutes or having meetings that will go to staff so that they're aware of the initiatives. All right, number 10, any attestation that you're signing. Sue talked about an attestation earlier that could, for example, perhaps the bonuses are not applicable and you're going to sign an attestation is saying we don't provide bonuses that would negatively affect a consumer's care. You want to make sure that you re-sign your attestations for the date of the validation review, because if you submitted your desktop application, that part 2, in April, and they're going to do the validation review in August, you want to make sure to tell them that still from April to August, this is still not applicable. So make sure it's signed and dated by a senior management representative on letterhead. Number 11, if URAC asks to take a document with them, be sure to make a copy of it to keep for yourselves and de-identify any PHI on it. If they're taking it with them, it's usually an indication that they want to bring a question to their team back at URAC. And it could be an issue, and you want to know what that issue could be. Let's say there is a file in question. You cannot prove to URAC, and you go into a corrective action decision because of this file based on information they took back with them. You can't prove that something after the validation review happened to show compliance. You must know what it is they took with them so that you can try and investigate it and find any missing information occurred before that date. So you want to make sure that you have everything that they're asking for in order to defend it upon, God forbid, an appeal. And we'll talk about that soon. We'll talk about corrective actions. Number 12 is create tent cards that identify your index dates, your desktop review and your RFI submission date, because you want to be able to show that anything that happened before this date is grandfathered, especially for new applicants. Let's say you have to demonstrate primary source verification for clinical staff whose job descriptions require it, and you have someone who's worked there for 9 years, and this is your first time applying. You don't have to demonstrate 9 years ago you did this. But anybody hired from your submission date forward, you need to be able to demonstrate implementation of that standard. So it's important to know what your index dates are and your RFI submission date, because maybe you changed something to now become compliant from that date forward. It looks like we have some questions before I send it back to Sue. Let's see.
Okay. We can talk about performance measure reporting and how it aligns with reaccreditation. As you may remember, those of you who have received accreditation, if you get accredited in 2020, January 1st of 2021, you have to start collecting the data. In 2022 is the first year you would report it. I believe it's every October 1st, URAC updates the measures requirements document that tells you very specifically what needs to be included, like how you're to gather your data, the report writing, things like that. The other thing you need to know, depending on the module that you're seeking accreditation for, you may have to have an outside entity review the validity of your data gathering. So organizations like Attest is one that comes to mind. URAC on their website lists those data validation companies that they approve and they've deemed to be appropriate to review data validation. There is a fee for the data validation company that you'll have to pay, and I believe it depends on the volume of data that they're reviewing. There's also an ISCA form. It's an information form that talks about your system and its capabilities. That has to be completed. They used to require you to submit it with your desktop review. That's no longer the case. It's usually the data validation company that talks to you about the ISCA form, and you can download a copy of it from the Resource Center. If you have any more specific questions about the measures, you can always get in touch with me via email at sdmarino@integralhs.com, integralhs.com, and I'd be happy to have a call with you or to schedule some time.
I'll take the next 3 questions. So regarding props for the interview, what would you recommend if the review is 100% virtual? What we recommend is having an agenda that has hyperlinks to all of those documents that they're requesting. And then during your interview, you can bring them up in the hyperlinks. So they will expect you to bring up those documents, that the quality minutes that will show access metrics, for example, or that, again, that business continuity plan. The next question is regarding review with all staff might be interviewed. How does this work when all staff is working remotely? So they often will have a group interview. So for the frontline staff, and you can give them the roster to choose from, or you can say, we've made these people available for that day. Who would you like to interview? And then they often will collect all the people. For the other interviews, it's up to you to choose who's going to be in that room. When we work with clients, we do a mock validation interview. You can see what the themes of the interviews are, and that's kind of our dry rehearsal, where we go through the questions and the standards to see who's the appropriate person in the room and how that works out. And then the distress caller for virtual people, what you should have set up is an instant message to one of your peers to be able to let them know you have a distress caller, and you can instant message the information to them just like you might when it's live, and then they can call 911 on your behalf while you stay on the line. Thank you for those questions. I'm going to hand it to you, Sue, for the corrective action section.
Sure. Okay, so the last piece that I'm going to cover is what happens when you have a period of time where you are out of compliance with URAC standards. And my advice to you is corrective action, corrective action, corrective action. You need to implement it as early as it is discovered. You need to identify what you're going to do about the issue that you've identified, how you're going to come back into compliance. You're going to identify what the root cause was in order to be able to demonstrate compliance. I would tell you, I have seen organizations with 3 months of compliance with an issue that was out of compliance for even 6 months, be able to demonstrate to URAC that they fixed the issue and it no longer is a problem. And they typically will accept that corrective action plans as a way to mitigate issues. If it is absolutely going to be discovered rule by URAC, I would tell you to announce the corrective action plan in advance of your on-site. They do not like surprises. It gives them an opportunity to look at your data pool and to identify when they should start looking for compliance. I believe there's one more question, Lesley. Can source verification of licensure be done by a bulk review with a licensure state, or does each license need to be verified individually?
The personnel file must demonstrate that you completed primary source verification for that individual, and that verification included a review to ensure that it is active without restrictions. So if you can pull it and demonstrate that it's primary source verified with that information, I can't see why not, but I've never seen that done historically. It's usually primary source verification for each individual.
Okay. Any last comments, Tom?
No, I'm just grateful that you all showed up, and we're delighted to have you here. You can, if you have any questions for any of us that occur to you after this webinar, the follow-up email will give you a way to contact us. We'd love to chat with you on the phone about your accreditation needs. And we are right now putting up poll questions. We would be so grateful if you just spend a minute or two doing a quick answer to this handful of poll questions before you log off. Back to you, Sue.
That's it. I was just going to remind all of us about the polling questions. Okay.
All right. Well, we'll leave the call going for another minute or two so that you have time to answer your poll questions. And if you have any other questions for us, you can post them. All right, they're rolling in.
Great.
Thanks everybody for attending.
Thank you. It's been great having you here.
All right.
Okay, I'm going to end the poll. Thank you so much.
All right.
There's a question.
Thanks, everybody.
Hold on, there's one question. Oh, thank you all.
Oh, that's just Richard. Hey, Richard. Good to see you. Bye-bye.